4-part video series on improving diabetes management and long-term care, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers with an interest in providing care to individuals with diabetes and metabolic syndrome. This first video will address the understanding of metabolic syndrome. You may watch each video in order or based upon your interest. The learning objectives for this session is to understand metabolic syndrome and its relationship to type 2 diabetes, and to understand complications of diabetes in those with metabolic syndrome. Our goal is that after this video, you will have a better understanding of this topic and how it applies to your own healthcare setting. So what is metabolic syndrome? It's a cluster of reversible conditions which are major risk factors, particularly in the cardiovascular world for the type 2 diabetic patient. The conditions together raise the risk of an individual developing atherosclerotic cardiovascular disease, insulin resistance, diabetes mellitus, and vascular and neurological complications such as cerebrovascular events or accidents, also known as strokes. So that's the definition. And the takeaway of that definition is that it's a cluster, not one or two. It's actually 3 of 5 or all 5 or 4 of 5 for that type 2 diabetic patient to have. So where we would know that their cardiovascular health is compromised to begin with. Then we're adding another layer. So that's the key takeaway for the definition of metabolic syndrome. So what is the impact? What does that mean? So we have a diabetes patient who is already insulin resistant, which causes even more microvascular damage, which can predispose that patient to endothelial dysfunction, vascular resistance, hypertension, vessel wall inflammation, renal impairment, and ischemic heart disease. A person with insulin resistance and microvascular damage coupled with macrovascular damage lead to now having several chronic diseases. This means there's inflammation of the arterial walls, which in turn results in a rise in blood pressure, which again leads to more problems such as hypertension and chronic kidney disease. A patient with diabetes is already at massive risks for all of these conditions, which now are even worse by adding metabolic syndrome. All of these components are related to weight gain, specifically intra-abdominal ectopic fat accumulation and a large waist circumference. Here are the major components, and this is what a clinician or other healthcare provider is going to look for. A low high-density lipoprotein, that's a good cholesterol. High blood pressure, meaning 130/85 or higher, and it can be just one number. So if you're 140/80, you still are technically have high blood pressure. Both of these need to be in range. High LDL, which is your bad cholesterol, and as a result of having high triglycerides. A fasting glucose greater than 126 for a person with diabetes. Again, any of these components are 100% related to weight, which is why this talk is focused on obesity and weight. Pregnancy is a significant contributor to weight gain in women. Data reveal that 42% of women gain more than the Institute of Medicine's recommended amount of weight during pregnancy. Weight gain is often considered a side effect of a combination of oral hormonal contraceptives, but causality has not been established. 7% of pregnant women have gestational diabetes. studies show an increased prevalence of metabolic syndrome in women with a history of GDM compared with those without it. Polycystic ovary syndrome has many characteristics similar to those of metabolic syndrome. In fact, the prevalence of metabolic syndrome in PCOS is approximately 43 to 47%, twice as high as the prevalence in the age-matched general population. Gestational diabetes. Women with a history of preeclampsia have a greater insulin resistance and an increased incidence of hypertension when examined years later. And although BMI increases with aging, the menopause does not seem to have a significant role in this increase. It does, however, promote a change in body fat distribution to increase central adiposity and subsequently enhance the likelihood of satisfying the metabolic syndrome criteria. In summary, our key takeaways are that people with metabolic syndrome have a higher risk of cardiovascular events, such as heart failure, myocardial infarction, and cerebrovascular accidents. This risk is even higher for people with type 2 diabetes, and the risk from metabolic syndrome can be greater than the risk from each of its individual components. Almost all patients with metabolic syndrome develop diabetes mellitus, which further elevates the risk of cardiovascular diseases and leads to microvascular complications. In our next video series, Partnering to Improve Diabetes Management Video 2, Diagnosing Metabolic Syndrome, will cover treatment options for metabolic syndrome and diabetes. Here are some resources and tools to further explore what we have covered in today's presentation. If you have questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.